If you can start with just giving us a basic overview of what exactly is depression.
So depression is a mental health condition that is underdiagnosed, undertreated, under-talked about, and it's treatable. It's something that afflicts a lot of people from childhood through adulthood, and it's something that can present in a multitude of ways. Sometimes people come in feeling sad. Children will often come in because their parents or their teachers note that they're irritable. So when that happens, it should trigger the family or the physician or the provider to begin the conversation to say, what's going on? Is there something more going on here than just some blues or something going on in your life?
I know there can be situational type depression. Would that look the same to somebody observing it?
Sure. So there are a lot of different categories of depression and types of depression. What you're talking about is called an adjustment disorder. And what happens with that is there's a situation that clearly explains why someone is sad. If there was a traumatic event, if there was a death of somebody who was close to the child, or maybe something happened to them, or they've been experiencing a chronic disease, and they've just been diagnosed with that. There's going to be sadness that comes out of that. Sometimes that will turn around, and they will just need to have counseling and talk about what they're going through and the feelings that they're having. And sometimes that will go into a full-blown depression.
Are there any stigmas or misconceptions about depression that you want to address? Because I know it can be very misunderstood.
Absolutely. And there's still the entire stigma around mental health. People feel like this is a weakness, this is something that if I were stronger, I could make it go away. I can handle this on my own. Why aren't I able to do this? And that feeds into it as well. It feeds into that poor self-image. Why am I different? Why can't I do this? And so they don't want to talk about it. And sometimes families don't want to recognize it because there may be issues in their family history where depression was treated in a way that we don't treat depression anymore. Maybe an ancestor was, had some horrible thing that happened, like they were locked in an institution, and so they don't want to even think that their child could maybe end up in that same type of situation, which we don't do anymore. But there's still that remaining stigma in society. I think it's partially American culture too, that you should be able to, pull yourself up by your bootstraps, and you should be able to do this on your own, and that you shouldn't need help. It's this self-determinism that makes it difficult. It's important that we talk about it to say, there are times when everybody needs help.
And you mentioned family history in there. If there were a child or a teen with a history of depression in the family, is that something you would kind of take note of and pay extra attention to if you're just seeing that child routinely, or even as a parent that you should be watching for?
Absolutely. And mental health conditions do run in families. So there is a higher prevalence of depression in a child, or there's going to be a more likely situation where a child will have depression if there are mental health conditions in the family. Somebody else in the family has anxiety or other mental health conditions, that child's going to be at a higher risk of having depression. So yes, we pay attention to that, and we do ask about family history. We also find out, what the history of that was, what the treatment was, what was successful for the family member who had that, and how they did.
In a situation like that, where it might be due to your family history and not an adjustment disorder, is there a typical age of onset that you might see symptoms of depression?
So depression does increase as we get older, meaning from 6 years of age or 5 years of age to 12 years of age, the incidence, maybe about 2.5 children out of 100 will have depression. When you get into the teenage years, from 13 to 18 years of age, it's about 5.5 out of 100 will have depression. When you get into adults, it's about 6.5, 7%, or 7 people out of 100 will have depression in any 12-month period. There are different breakdowns by demographics, by race and ethnicity. But yeah, so it does increase as the child gets older.